The Senate is still debating it, and the Democrats say they can pass the bill by Christmas. But the government's health care program for the poor, that's Medicaid, already in truly critical condition. The states pay for much of Medicaid, and many of those states already cannot afford it. Our next guest says it's only going to get worse. Dr. Sreedhar Potarazu is the president and CEO of Vital Spring Technologies. Good to see you back again, Doctor.
Glad to be back.
Now, I've read your research, and you're saying that by the year 2013, there will be an extra 18 million Americans on Medicaid. Is that an accurate number?
That's a pretty accurate number, and that's the number of people that could be spilled over into the state system.
And that's because the health care plan that's winding its way through, if it's enacted, it will push people into the Medicaid system. That's what it does.
That's right. And we've adjusted the poverty levels for which people actually can qualify so that people will actually now be eligible that previously weren't eligible for Medicaid. And what happens is that most of these people that end up on Medicaid are actually the people that are going to be sicker. They're going to cost more. Johns Hopkins is a great example. They're in a state of Maryland where they're capitated, and they had to take on almost 30,000 new people into the system over the last year.
That's because of the recession.
That's because of the recession,
yeah.
But that ended up in a net loss for them of about $15 million. And what the states are struggling with is how do we take on all of these new, sicker people and still be held to the task to bend the cost curve?
Because the states pay, what, roughly half of Medicaid costs? The federal government picks up the rest, something like that, is that right?
Something like that.
Depends on which state,
That's right.
I believe.
Well, that's the other thing. It depends on the state. Every state is not consistent. And part of the push now is to open up the markets and create these exchanges where we can buy across state lines. Well, how do you do that when every state is, in fact, a different territory?
Okay, we'll stick with Medicaid for a second. If you push 18 million more people onto Medicaid and the states have to pay some of it, that implies, well, the states can't afford it, and they cannot pay the hospitals and the doctors within Medicaid as much as they need to receive so that they make a profit.
Right.
Well, what are you saying then? That this is a non-starter, that it'll bankrupt the states, or?
I think it is a non-starter. And the challenge to get these 60 votes is a lot of these senators, especially the ones that are up for re-election, are going to be in the dilemma of, do we bankrupt the state, especially where they've got a lot of folks that are going to come in as uninsured?
But I'll tell you exactly what the Senate is going to do. The Senate is going to say, all right, well, the federal government can assume these extra Medicaid costs, not the states, for a period of 3 or 4 or 5 years. After that, the states will be on their own. That will allow the senators to vote for increased state costs from Medicaid, right?
You know, there's a lot of loopholes that could come through, and I wouldn't be surprised if some of the senators try to pull this off.
Oh, it will, it will. Senator Reid is going to do that in Nevada. In Nevada,
Sure.
they're going to pay, the feds are going to pay all the extra Medicaid costs for a period of 3 or 4 years. Guaranteed.
Well, that's the challenge, though, is that these sicker people end up costing more, and somewhere Nevada is going to lose out. And whether they pay for it today or defer the payment later on, unless we ship all of these people from Nevada to some other country, we're going to either pay today or tomorrow. But it's, as we've said before, fuzzy economics in terms of when we actually pay for them.
Dr. Potarazu, thank you very much indeed. Clarity as usual. We appreciate it. Thank you.
Glad to be back.